today to Dr. Ben Talei's office to do the lip lift procedure. For those of you who don't know, it's literally a procedure or surgery that actually lifts the top lip so that way you can have better height to not only the cupid's bow, but also remove some of the skin that makes this area look really long. It's really good for people that look like me, that you can't really see their upper teeth when they talk, and when you smile, it's not so straining to smile like this. Sorry for the food on my teeth. I just had a sandwich. I think that it'd be really nice for me because I do have beautiful teeth that I'd like to show more. However, I do feel in pictures that it looks like I'm straining to smile. So if you were to imagine it, by rolling the lip up and out, I'm able to expose more teeth. So you'll obviously see the after soon, but I'm pretty stoked. So the way that I found out about this procedure is that, I don't know if you all know, but Kylie Jenner had this huge lip transformation, and we all know that she did do lip fillers. However, her lip anatomy changed, and what was rumored is that she had the lip procedure done. Personally, I've had a rhinoplasty, so there has been a lot of research and evidence showing that after rhinoplasty, the length from the base of your nose here down to the cupid's bow does tend to elongate, and this is an area that elongates anyways with age. But more specifically in rhinoplasty nose job patients is that you see this crease that comes underneath the columella here. So I'm really excited to get rid of that crease when I smile personally. I've been researching it for about 1.5 years now and ready to take the plunge. I decided to go with Dr. Talei because he does tons of them. He does about on average 8 a week, and his work is truly natural, phenomenal, and just how patients smile in their after photo was the most impressive part because I want to look like, of course, myself. So the way that he does the procedures, he puts you in the back of the office. He does it under local anesthesia. It's not in a hospital setting where they put you under general. He gives me a numbing shot that I believe is similar to the one that I administer for my lip injections at Beauty Boost Med Spa. And then he gives you a Valium so that way you're nice and chill. The recovery, I think, is from what it was explained, is about 3 weeks you look really swollen. And then at the 3-month mark, you see where your final results are at. I said extra strength Tylenol should be all I need when it comes to post-op. Some people do need Percocet. Hopefully I won't be one of those because I don't like those narcotics. And then antibiotics and steroids are part of the post-care as well. So I don't have filler in my top lip. I actually dissolve that completely so that way Dr. Ben Talei has a clean slate to work with. I do have a little residual filler from a prior injection in my bottom lip from about like 4 months ago. I am planning in 3 months, once my lip completely heals, to do filler. The reason why I have decided to do this approach versus just having the filler in my lip is because I have, again, a clean slate to work off of, but also when the lip is higher up, you can see more of the filler, and maybe I won't need as much filler. My boyfriend.
Hey, how much did you consider your boyfriend's input on going forward with this procedure?
It would have to be 0. My money, my body.
But I'm gonna miss that part of your lip so much. Ask the doctor if he'll put it in a jar for me so I can keep it close by.
You're gonna miss the sliver even with a pimple on it?
Uh-huh.
Okay. I'll make sure that's intact. I'll put that request in for you.
Thank you.
Crazy right now.
No, I know what swelling looks like though, you know?
Yeah.
Those teeth.
The teeth are there, the shape is there,
Oh my god.
the accent, and you're turned up now, so it looks great.
Wait, I'm dead. This looks so good. Oh my god, my lip looks so good.
So, how do you feel?
Good. Give me some water. Oh shit, I forgot I'm numb. Alright, I just got back home from the lip lift procedure, and as you can see, I'm super swollen. The whole procedure only took a matter of like 20, maybe 30 minutes max. I was done throughout the entire process. Super comfortable. Dr. Talei was super professional and very knowledgeable, super smart guy. But I just took some steroids to help with the swelling and my antibiotics, and I have a lot of good ointment on it that is a antibiotic, and I will fill you in for the healing in the next few days. Okay guys, this is post-op day 1, and as you can see, I'm still pretty swollen and I have some nice bruising settling in. Looks like it's probably a little hematoma, but I'm sure this will resolve once the blood under the skin does dissolve. The stitches are still intact, and I have some antibiotic ointment. That's why it's a little bit shiny. It looks a lot worse than it feels. Like, I really don't feel any pain. It's just a little uncomfortable doing a couple expressions, but extra strength Tylenol is all I'm taking. I don't even need the Percocet that was prescribed, which is a narcotic for pain. And I will keep you guys updated, but so far so good. Just yeah, I'd say a little bit numb, but I think it's gonna heal beautifully. Okay, so I realized I haven't filmed in a few days on my progress for my lip lift procedure, but it is post-op day 5, and as you can see, I don't have any more sutures in place. It is a little bit glossy because I do have Aquaphor. That was the doctor's instruction to make sure it's still moist for about a week out. So I'm making sure that I am protected from the sun and the swelling is going down. I stopped all my antibiotics and antivirals, and I'm pretty stoked on the progress, so I'll keep you updated. Okay guys, it's post-op day 10 from the modified lip lift with Dr. Talei. I am so happy with how it's turning out. I'm still a little bit swollen and my scar's a little bit tight, but I do anticipate this to get better with time. He will be doing the CO2 laser for me. I believe it's week 4 after the procedure, so that's gonna help soften it, help with the pigment, but my incision is pretty impressive how it's healing, and I'm so excited until I see the final results, so stay tuned. So some of you might think that that was not necessary procedure, but I'm gonna go ahead and insert a clip of me talking before where you can actually see that my upper lip was elongated. Not until I showed my coworkers and my friends did they really realize that this procedure was actually an amazing one for me. So I hope you guys can see the difference and enjoy the results with me. The most common question I got about this procedure was how much was it? And to me, this is on my face, so I was willing to invest a high price tag to this, and I was willing to go to the best of the best surgeon. So with that being said, it was a little bit pricey. On average, lip lifts range from $2,000 to I believe $5,000. The surgeon that I went with, his prices range from $6,000 to $8,500. Mine was $8,500. I was willing to invest that in my face because I didn't want to mess around. I'm really happy with the results, so I don't regret this investment, but it is an investment and I have no regrets. So if you like this video, please like, follow, and subscribe to us on Instagram. Bye.